Yeah,
Good
Dr.
morning, everyone.
Kashyap. Yeah.
My presentation is in the form of video. It has a voiceover. So I'm going to show 3 cases of posterior polar cataract. The first is with the femto technique, the second is with phaco, and third has a complication.
Posterior polar cataracts possess serious risk of PCR at any stage of the surgery. The incidence of posterior polar cataracts is more in younger patients compared to those in the middle age or elderly. Low flow, low pressure surgery is preferred in
तो
posterior
ठीक कर
polar
दिया आवाज.
cataracts. Care is taken that the chamber is underfilled and the eye is soft. Flaps does have a major role in posterior polar cataract in preventing PCR. Since the laser cuts are in vertical and horizontal planes,
Hydrodelineation is done at multiple points, and you can see the ring, and it is separated epinucleus from nucleus. And now by low parameters are used, and the epinucleus is separated sideways, and the central part is not touched. So with the sweeping motion, all the sideways epinucleus is. Now you can see when I am doing this, the central plaque is also coming. इसमें आवाज नहीं आ रही. आप लोग कुछ कर रहे हैं? म्यूजिक आ रहा है? शुरू में आ रहा था.
No, I think if you can. Yeah, please. But I think you can finish the last case and you can explain it along. That's better. So you already have explained it. Voiceover will have the same thing, I think. And we always want to hear you rather than the voiceover.
Tackling posterior polar cataract.
We have Dr. Rajendra Kumar
Flax
Gupta here.
does have a major role in posterior polar cataract in preventing PCR.
Dr. Nagendra
Since the
Prasad.
laser cuts are in vertical and horizontal planes and they leave a very thin posterior epinuclear plate protecting the weaker central posterior capsule. Whether flax or fake, we have to consider certain major factors like hydrodelineation from the center to the periphery and no rotation, loosening the epinucleus from the periphery from all sides. Flax possess serious risk of PCR at any stage of the surgery. The incidence of posterior polar cataracts is more in younger patients compared to those in the middle age or elderly. Low flow, low pressure surgery is preferred in posterior polar cataracts. Care is taken that the chamber is underfilled and the eye is soft. Flax does have a major role in posterior polar cataract in preventing PCR. Since the laser cuts are in vertical and horizontal planes and they leave a very thin posterior epinuclear plate protecting the weaker central posterior capsule.
Can you sort it out and we can have Dr. Mohanta?
Whether flax or fake plaque, maintaining a central cushion thus protecting the weak capsule. I am trying to chop the delineated and laser chopped nuclear fragments, taking care not to disturb the central part. We keep hydro or visco delineating and pull the nucleus and epinucleus from the periphery towards the center and eat it up. Visco is being pushed and the epinuclear plate is being phacoemulsified. Very low parameters are used and after the completion viscoelastic is injected. This is the second case where we have not done flax, so it is a little different. Rhexis is being completed. Attaining a perfectly sized capsular rhexis is extremely important as we need to take help of rhexis to achieve optic capture in the event of posterior capsular tear. You can now see the nucleus is separated from the epinucleus. When you eat up the peripheral part, you have to flip the epinuclear plate. Epinuclear plate and cortex is loosened from all sides and care has to be taken that only one side is not aspirated till the posterior capsular plaque, as it may end up opening the weak posterior capsule. Now, again, we eat up the central part if it is properly hydrodelineated and separated from the epinucleus. We have to keep patience. And in the last, all loosened epinuclear plate comes out very easily along with the central posterior plaque. We inject viscoelastic before coming out. This is the third case of posterior polar cataract, which is different, as usually in posterior polar cataracts the nucleus is soft and this was a hard cataract. We have tried central to periphery hydrodelineation, whatever was possible. chopping is being done of the peripheral part and some of the central part, which is hydrodelineated by visco and saline.
Some part of the nucleus has dropped.
One has to be very patient and skillful with the chopper or Sinskey hook.
Now after the vitrectomy, anterior vitrectomy has been done, I am doing irrigation and BHARTI.
And look here, while doing the same, there is a PCR. Nucleus has not sunk in fully, so part of the nucleus is shelled out with the help of Sinskey hook into the anterior chamber.
And maintenance of low infusion pressure, you can see the IOP is less. Maintenance of the low infusion pressure apart from the low fluids is very important in managing the posterior polar cataract. Thank you. So I showed you 3 cases.
Phacoemulsification
Much of voiceover and the
We could get the concept.
is being used for the nucleus management after putting viscoelastic. All has not come, as some amount of cortical matter and nuclear matter has gone into the vitreous cavity.
hydrodelineation.
With the phaco probe, no?
Yes,
We
yes,
try to,
yes.
so that we can lollipop the whole nucleus up.
Yes.
But the point is that what my worst fears were actually came to in the third case.
We are now using a vitrectomy cutter for removal of the rest of the nuclear fragments, epinucleus and cortical matter. Now irrigation and aspiration has become very easy.
Catch the epinucleus or the posterior capsule, which happened in this case. So
It
how do
happened in this case, but we have to remove the delineated epinucleus and all those parts first. And if the lollipop nucleus comes,
No. The technique has an inherent risk of damaging the posterior capsule in the periphery, mid-periphery, when you are trying to delineate the epinucleus and the nucleus with the phaco probe itself. So why not we just do only a perfect hydro delineation and delineate the nucleus with the fluid itself?
delineated it first. In all the cases I have done, first case was femto, and the second and third case was phaco. So I delineated it at multiple points.
No, this technique.
Hydro delineation I did.
No, how do you actually think that it is more advantageous than the routine conventional technique of posterior polar management?
It does help us, that's our way, but in one case it could not click.
Okay, anyway, sorry for all the technical glitches, but it was something to take home.